Hello, wonderful community. Last video, we discussed how to navigate an intake session. This time, we're going to talk about how to navigate a termination session. Think of it as like the grand finale of therapy. Sometimes we want it to be wrapped up perfectly. Sometimes we cry. Sometimes we're excited. So I'm going to talk to you about the way that I navigate a final session with a client. I remember when I was a new therapist, I was like bracing for impact whenever I would have to talk to my clients about the termination session, because I kept thinking, what if they're hurt? How are they going to feel about this? And what if they feel like I'm breaking up with them? Well, you are. And you have to talk about breakups, and we have to be open about it, and we have to be transparent. So if there's a little apprehension or a little fear, I just want to say that's normal. At least it was normal for me. And if you're new here, my name is Dr. Kristen Casey. I'm a licensed clinical psychologist, and I give quick tips to therapists on how to navigate certain things in therapy. A lot of people in this community are in grad programs, or they're seasoned therapists, or they just want to shake things up and do things differently. So if that's you, hit subscribe and follow along. So how do we prepare for the termination session? One thing that I've done to prepare myself for the termination session and prepare clients, more importantly, is to talk about it in the intake and to talk about it throughout therapy. Some clients might think that therapy is forever, and newsflash, it is not. Things happen, people move on, people go into different positions, you meet your therapy goals, or something abrupt happens that probably feels weird. It's almost like growing a little thick skin around the fact that termination is normal, it is a part of therapy, and it's actually a good thing. It is a really good thing to know how to terminate a client, because you know that they've either met their goals, or they're better suited for another therapist, or therapy might actually be causing more harm. So I know that these are things that not many of us like to talk about, but let's get into it. So how do we prepare for termination? And the easy answer to that is we prepare all along, right? We do it in the intake session. We talk about, hey, therapy is time limited. I'm not going to be here forever. We're not going to be in this situation forever. And there's going to be a point in which we have therapy for the last time. And it feels sad, and it also feels exciting. It could feel mixed up for most people. I know as a client in therapy, when my therapist has brought up termination to me, initially I was like, oh my gosh, what if I'm not ready? What if I'm not ready to spread my wings and fly? What if I need you for something, you know? The key about termination is to empower clients, to let them know that they could do this on their own if they're ready, you know, if they've met their treatment goals. And it's a really difficult conversation for most new therapists. And essentially, termination is a very normal and expected part of therapy. So let's talk about how to prepare for termination. Preparation starts in the intake, in my opinion. This, again, comes from my own experience. Other therapists might do it differently, and other therapists are just as valid in their experience as mine. So for me, I talk about it in the intake. I'll say, hey, you know, these are our treatment goals. This is where we think therapy might go. We might veer off. It just depends on the path that we take. But eventually there's going to be a time when you and I have therapy for the last time. And I know it feels weird to talk about it right now, but it's really important for you to know these things just so that there's no surprises and you know exactly what you're consenting to in this intake. And a lot of clients will have questions. How do I know if I'm ready to terminate? How will you know? Will you tell me? Can I tell you? You know, all these questions pop up, and I'll, you know, create some space to talk about the fact that, you know, there are certain treatment goals that we have here. And once we've met the treatment goals, then therapy is no longer clinically indicated. And when I talk to clients about it in that way, then they might say, oh, okay, there's like a rationale here, or there's a reason. And then clients might say, but what if I want to continue meeting with you? Or what if I just find it helpful? It really is up to the therapist to decide if the therapy is clinically indicated at that time. And it's really hard to go through scenarios because it just depends, as you know, on each client. Think about all the clients you have in your mind and how different they all are. Before we get into the rest of how to terminate a client, I want to talk about some of the reasons in which you might have to abruptly terminate a client. There are certain scenarios that are rare, just in my own experience, where you might have to terminate a client when you didn't actually have time to prepare for. And there's a couple of different ways in which this might unfold. The first is if a client's behavior poses a threat to you as a therapist. If you feel harassed, if they're, you know, making advances at you, or they're engaging in threatening behavior where you feel like your life is threatened, the APA Ethics Code talks all about the fact that therapists should maintain their own safety as well as the safety of their clients. And if you feel unsafe in a situation, you are allowed to terminate. Another reason which you might have to terminate therapy as a therapist abruptly is your own life. You might have a medical illness, you might have something going on in your life in which you cannot show up to sessions, and it would be not in your client's best interest to show up to sessions. For example, I had a friend who had a serious medical concern pop up for her, and she wasn't able to actually go to her sessions because she was dealing with like a life-threatening illness. So she had to call all of her clients and say, hey, I'm very sorry. I just don't know exactly when I'm going to be better, so I have to refer you to a new therapist. It is not personal. I'm going through something and I want to be there for you 100% and I can't right now. Another reason that therapists might abruptly end a therapy session or a therapeutic relationship is because of ethical violations. And the last one that I came up with is in rare circumstances, a client might not be benefiting from therapy. And in my intake session, in my intake video, if you go back to that video, I talked all about the ways in which we're not for everybody and everybody isn't for us. So there might be circumstances where you're meeting with a client and you think it's going well and they don't think it's going well. It happens. It literally happens. It's okay. So it's up to you as a therapist to notice, okay, is this client benefiting or is this client not benefiting? And you can ask them as well, like, how is therapy going? You know, are you getting anything out of it? I'm not going to take it personally. Please be honest with me. I want to be able to get you the care that you need in a really timely manner because I might have to provide you with a referral. And you might actually be doing therapy with this client potentially for a couple of sessions until they realize like, this isn't for me. This isn't a good fit. And that, again, that's okay. So you might have to, in that session, say, okay, if you're not benefiting from it, it doesn't really make sense for us to do any more sessions, you know, if this is really, really, really not helpful. What sort of therapist are you looking for? What sort of modality are you looking for? What would make it more helpful? And if you know as a therapist you cannot provide that, it is very important to be honest with yourself. It is very hard to be honest with yourself in those moments, but it's very important because if you're not honest with yourself, then you really, really are doing a lot of harm to the client. Let's summarize. In the intake session, we bring up termination. In the termination session, pretty obvious, we're terminating. In between there's therapy, right? You're doing all the therapy, you're doing all the things, you're being a therapist, they're being a client. So in between this, what happens? We still have to talk about termination. We still have to bring it up. At least I think that we do. So every couple of months, depending on the client, depending on how long you're with this client for, if it's a really short evidence-based modality, you might not have to bring it up as much. But if you're seeing a client for maybe a longer period of time, if you're doing psychodynamic work or deeper work where it's process-oriented and you might need more time, you might bring it up every now and then. And how I bring this up is really specific. So I'll ask clients, how is therapy going? Are we hitting on all the things you want to hit on? Are we missing anything? Is there anything that you want more of, less of? And clients will open and be honest with you and say, hey, I need this, I need that. And there might be times where clients are showing up to therapy and they don't really have much to talk about because you've met your treatment goals. So in those moments when you're noticing, okay, I'm noticing a shift, whenever you notice that shift, it might be helpful to bring it up. Hey, I've noticed that in the past, we've, nailed down all these goals. We've talked about all these things. And I've noticed that you've been coming to session saying, I don't really know what I want to talk about, or I don't really know where to go from here. Those are indicators that you may have met your treatment goals or you're close to meeting your treatment goals. There could be other reasons why a client would come to session and say, I don't know what to talk about. It might be fear. It might be embarrassment. It might be, it's hard to be vulnerable. They might not know how to guide the session, which is not their job to. So providing some education in those moments would be helpful. And I'll always check in with clients and say, how is therapy going? And then we take it from there. I might also say halfway through therapy, there's going to be a time when you're going to spread your wings and fly. I'll make those, not hints, but I'll just let them know I'm thinking that way. Because I think a lot of clients might think, how long is this going to go on for? How long am I going to have to be in therapy for? It's important for them to know how long, or at least have an estimate. Okay, so let's fast forward to maybe 3 sessions before the termination session. You have 3 sessions and then you terminate. So basically, if you think about it, if you see a client weekly, you have a month. In that month, so many things can happen. They might say, hey, I'm ready sooner, or hey, I need more time. Or we might realize, like from a clinical perspective, yeah, they need more time in therapy, or they don't. So depends on you. Just be able to roll with it. I'll always bring up in those sessions, hey, we have 3 more sessions, we have 2 more sessions, we have 1 more session. And when it is 1 session before the termination session, meaning your 3rd session of 4, if we're thinking about just termination in a block like that, I might say, hey, next session it's gonna be our last session. In the termination session, what I do specifically is review our goals, talk about all the progress the client has made, their strengths and areas of growth, and where they might go from here. So if you think about what life might be like without a therapist for this particular client, what might they struggle with? What resources might they need? And you kind of think about that ahead of time and you provide them with some ideas or options. I also like to talk about significant moments that we've shared, and you can always go through progress notes or your own psychotherapy notes to find these, or even your own memory because you've been with this client for as long as you have, and talk about the significant moments that you have shared in therapy with them or that they have shared with you in general. Maybe how certain parts of therapy may have been challenging, or they may have felt like, oh my gosh, this is so hard for me, and they were able to overcome these things. So those significant moments are really important to reflect on in the last session so that the client remembers. Because a lot of times when you're a client, and a lot of therapists are clients themselves, we don't realize these things when we're actively processing in our therapy sessions as a client. A lot of stuff gets lost because you're just focused on processing and getting stuff out and dealing with the emotions and feelings, and really feeling all these things. So it's important as a therapist to be able to share those moments with our clients in the termination session. And if a client is struggling with the termination session and they feel really overwhelmed with emotion, that's okay. That is completely normal. That is totally okay. A very normal response to ending a relationship. And depending on the client, especially for clients with anxious attachment, or maybe they've come to you for relationship issues or concerns, it might be really hard to end a relationship or a connection that has been so helpful for them. So really being mindful of all these things is important. And I'll tell my clients a lot of times, like, hey, it's almost like we're packing you a suitcase for your next adventure. You're able to engage in therapy again. This isn't like the end of your therapy career, so to say. It's the end of our therapeutic relationship based on the goals that we talked about in our intake. I want to pivot really quick and talk about the clients who are very ready for termination, and they can't wait, and they're excited, and they just came here to learn some skills, to get through some stuff and leave. And those clients are ready, and you might have to process less emotions with them potentially. There might be more emotions of excitement, or I can't believe I did this, or I feel so accomplished, or I feel so good about myself. And all of those emotions are equally as important. And it's really important to talk about those emotions with your clients in that last therapy session as well. And if you're a therapist who's struggling with the termination sessions, one thing that's helped me is role playing with my other therapist friends. And it sounds like, oh, it's so grad school, but it's helpful. It's helpful. And if you don't have somebody to role play with, role play in the mirror. Look yourself in the eyes, just as like you look at your client in the eyes, or through the camera, through telehealth, and really try to imagine what it might feel like for you. Because if you are feeling some feelings, which are normal, it's not always appropriate to discuss those feelings with the client in termination. It's similar to self-disclosure. So there's ways in which we self-disclose to help the client and ways in which self-disclosure is not helpful. And if I go back in the archive, I could think of several sessions that I've had where the client was overwhelmed with emotion, overwhelmed with oh my gosh, I can't believe this is our last session. This is so hard for me. And maybe it's hard for me too. That's okay. You've established a connection with this human. It makes sense. It might not make sense to voice it depending on the client, the modality, where you're at in your therapeutic relationship. I think it's okay to say, hey, endings are bittersweet. That's usually what I say. Endings are bittersweet. I'm really excited for you to move on. And it's also really hard to not have therapy, right? It's hard. So trying to maintain your professionalism, all the while trying to be a human. It's a science and an art. So if you don't feel good at it, or you're feeling like, oh my gosh, like I am not going to get this down, you will. It's just a matter of time, because every client is going to present so differently. And it's hard to say with any level of certainty that you're going to nail the termination session every time. And what does it mean to nail it? Does it mean to not have emotions, or just to be able to end it perfectly? That usually never happens either. It's okay. It's really okay. Have some empathy for yourself during termination sessions. You've really helped and guided this client up until this point. And you might also have emotions too. And that's really important to be able to process in your own therapy or supervision or with consultation with another therapist. All right, my friends, let's wrap up. We're terminating this video. Termination is an essential part of therapy. And as newer therapists, seasoned therapists, therapists in general, it can just feel bittersweet. And for the client, it might feel that way too. On the other hand, there's outliers, right? There might be clients who are extremely excited to end therapy because they are so done processing their emotions and they want to move on. And there are clients who might not want to let go. It happens. In your career, you'll see all of it. It's important to prepare our clients for termination way before termination happens. And that preparation can take place in the intake, throughout your therapy sessions, and then obviously during the termination session itself. And we also want to prepare our clients for what's to come after therapy ends. So we want to create a toolbox, a little suitcase for them of skills, things to remember, challenges that they might face, and resources that will help guide them in their next endeavor. I know we focus a lot on our clients, and therapist to therapist, it is okay to have feelings about ending a session with a client or ending therapy with a client. It happens. It really does. It's important to recognize those emotions and feelings potentially before you go into the session, or even if you notice it in the termination session. Think about it like self-disclosure. It's not always helpful to voice it as intensely as we're feeling it to the client. So just be mindful of our emotions and feelings and creating a professional landscape for them to experience the emotions without having to take care of ours. and you should be good to go. If you found this video helpful, give it a thumbs up, like, share, subscribe, send it to your friends.